Deep vein thrombosis is when we get a clot in the deeper veins in our legs, and that can be quite dangerous because it can break up, float through the venous system to your heart and lodge in your lungs, and in those sort of cases can be very dangerous for your health and even fatal. The symptoms of DVT or deep vein thrombosis initially are pain or swelling in the leg. Also, people might understand that they could get this sort of problem on long distance flights, but it gets called economy class syndrome in that case as well. But pain, swelling, sudden swelling in your leg is what DVT is like. It depends on what we need to do for someone, what treatments we'll put in place. In the acute setting, there might be blood clot-busting medications that we'll use to open up the veins again and to allow the blood to flow normally and to remove the clot. That's not for everybody, but it is an available treatment. In some people, they'll need a stent in their vein to keep it open once the clot's removed. Deep vein thrombosis is a clot in the deeper veins of our leg and pelvis. Once you have a DVT, 2/3 of us don't have the clot go away fully. In fact, it scars the vein. And when that happens, we end up with swelling, aching, pain in your leg over the rest of your life. And particularly that swelling can cause damage to the skin in the long term. Treatments for DVT initially is blood thinning medication, but the treatments for the long-term problems are things like stockings to try and prevent the swelling and aching. If the deep vein thrombosis blocks up the vein in your pelvis, that can be reopened with a stent if absolutely necessary.